Welcome to Life Dynamix TV. I'm Stephen Farrell. On today's episode, our host Jami McAllister speaks with internationally known psychiatrist Mitchell Gibson. Also throughout the show, you will hear from other wellness experts who will share with you their life enhancement tips. So join us for a new episode of Life Dynamix TV, the new science of energetic living.
I'm Jami McAllister with Life Dynamix. Today, I am here with Dr. Mitchell Gibson, author and psychiatrist, to speak to him of his expertise in mental health. Dr. Gibson, what factors influence mental health?
There are probably three important factors that influence mental health. One is the ability to form healthy, stable relationships with people in your home environment and at work. Another is your mental diet, what you put into your mind, the books that you read, what you watch on television. Also, the ability to understand when something is wrong with your mind or your emotions, to be able to seek help for that. If, for instance, you feel like you're down or depressed or anxious more than you should be, talk to somebody about that or get it evaluated. There's no shame or stigma about that. Mental health is very much like physical health. If you take care of it, you have much more life and longevity and quality in your life.
Wonderful. How important do you feel components play in mental health, such as exercise and nutrition?
There are a number of good research studies that look at mental health and physical health, and there's a definite connection between the two. There was a study at Duke University, I believe in 1988, that looked at people that worked out a minimum of 20 minutes a day, 3 times a week, and people that did not. And it followed them in what we call a longitudinal study over about a 10-year period. And it found that the people that worked out had fewer heart attacks, they had fewer strokes, they didn't have any episodes of being admitted to a psychiatric hospital, and they reported on the mental health examinations that were done periodically, they felt better. So it seems that physical exercise will help a person function better mentally.
Wonderful. Can you tell me some effective strategies that someone who is dealing with depression might use?
Depression is probably the most common mental illness that we treat as psychiatrists. Depression is probably the leading cause of disability in the entire world. Most people don't know that. When you look at all the causes of things that make people miss work, such as diabetes, heart trouble, cancer, injuries of all types, depression is number one. One of the things that you can do to stop or treat depression is working with someone in your life to talk about the little stresses that bother you. Meditation is a good tool for that. So that if you just sit down in a chair listening to quiet music 15, 20 minutes a day, that really helps. Speaking with someone about the stresses in your life really helps. Watching your diet. A diet that is low in cholesterol, high in protein, and low in carbohydrates has a lower tendency of leading toward a depressed lifestyle than a diet that has like a lot of sugar, alcohol, cigarettes, that sort of thing, also lead toward depression. Taking care of the inside of who you are helps you take care of the outside, and it also helps stop the episodes of depression before they come up.
Wonderful. Thank you, Dr. Gibson. It is now time for us to take a break. We will return with psychiatrist and author Dr. Gibson. Hi, I'm Jami with Life Dynamix, and I'm here today with Travis to see what kind of questions he has for our experts.
What are trans fats?
Trans fats are man-altered fats. The difference between a healthy fat that we get in our diet and a trans fat is the bonding between carbons of the triglyceride in the fat. This change that's made by man in the bonding perverts the food so that it is no longer recognized as normal food to our body. Furthermore, the modification does not allow us to break down the fat and utilize it as we would a normal fat. Trans fats are produced in the manufacture of various foods because they preserve the shelf life of the food. It's quite obvious and well known now that this modification of the foods is actually detrimental to our species.
We are back with mental health expert Dr. Mitchell Gibson. Dr. Gibson, I heard that you received the Albert Einstein Foundation Research Award for your work in sleep disorders. Any suggestions for people who are having a hard time with sleep?
About 1/3 of Americans have difficulty getting what we call a normal night's sleep. A normal night's sleep is about 7 to 7.5 hours for most people. People that sleep at least that long live longer and have a better quality of life. One of the things you could do to help sleep better at night is to modify the temperature in your room. Most people don't really recognize that the temperature may be too high or too low. About 72 or thereabouts is about a good temperature for most people. Also, try not to look at TV at least a half hour before you go to bed, or don't read in bed right before you try to go to sleep. And watch stimulants and alcohol, or at least a couple hours before you try to go to sleep. And if you smoke, try not to smoke at least an hour or so before you try to go to sleep. Nicotine's a stimulant, it can keep you up.
Wonderful. Now, I understand you are a board-certified forensic psychiatrist. Can you explain to us what a forensic psychiatrist is?
What is a forensic psychiatrist? A forensic psychiatrist is not like a forensic pathologist or a forensic medical specialist. We work in court systems to help people that have mental problems that have a legal basis. So, for instance, if a person works in a bank and they witness a robbery, and following the robbery they have difficulty coming into work, they might have something we call post-traumatic stress disorder. Well, after that diagnosis is made, they would need to be seen by a psychiatrist, and then that psychiatrist would go to court and help them get benefits if necessary. Or if a person is, for instance, a victim of a crime, and after that crime they have difficulty with sexuality or depression or sleeping, then I would go and verify that the crime caused a mental problem. So anything that combines court-related matters and mental health, that's where forensic psychiatrist comes in.
Wonderful. It is now time for another break. Please join us when we return with Dr. Mitchell Gibson.
Hi, this is Silver Rose with key number 3 to 7 keys to passionate self-care. Key number 3 is be careful what you feed your mind. Now, most of us spend a lot of time worried about what we feed our bodies. Diet books are the #1 sellers on any list that you look at. If there's a new diet book out, particularly if Oprah endorses it, then all of a sudden it's a bestseller. But it's really important to be careful what it is that you feed your mind. And the truth is that if you're careful what you feed your mind, your body will actually take care of itself. Because most of the time when we're abusing our body by overeating or not exercising, etc., it's because of what we're feeding our minds. So a couple of things you want to look at. #1 is, what do you do right before you go to bed every night? Most people watch the news. Now, you would never read your children a horror story before they go to bed and ask them to sleep peacefully. And yet, you watch the news where there's rape, there's car crashes, there's economic crises, there's war, all sorts of things, and then you expect to lay your head down on the pillow and sleep peacefully. At least with your children, you could say, it's only make-believe. So be very careful what it is that you feed your mind. When you wake up in the morning, what do? I met this wonderful old man one time. I went to listen to some live music, and there was a piano player there, and he had a following of senior citizens. And there was an old man sitting next to me in a wing-back chair, and every once in a while he would get up and he would dance, and he was a really good dancer also. And at one point he sat down next to me and he said, you know, I have a pacemaker, and I'm only good for a couple of minutes, but I enjoy every minute of it. And as we got to chatting, one of the things that he told me is that when he wakes up in the morning, he has deliberately on his radio music that's lively. And so when he wakes up and he hears the music, he gets out of bed and dances. What would your life be like if you get out of bed every day and dance? He feeds his mind positive things. Music is one of the best things that you can feed your mind, happy music. Now look, I'm not against country western music. Some of it's wonderful. But if you're listening to all that crying your beer music, it's going to have an impact on your emotions and on your life. So listen to happy music. Children's music is one of the best things to listen to. Certainly classical music will absolutely enrich your soul. When you get up in the morning, look and see, what you're doing, what you're feeding your mind. The other part of it is what kind of self-talk? What kind of self-talk are you feeding your mind? You see, as I've worked with people over the years, one of the things that I've come to understand is that for many of us, if we talk to small children the way we talk to ourselves, we would be arrested for child abuse. When you say things to yourself like, what's wrong with you? How could you be so stupid? I can't believe you did that again. That is not a good way to feed your mind. So key number 3 to passionate self-care is be very careful what you feed your mind, because it will have a huge impact on the quality of your life. Thanks very much.
Hi, I'm Stephen Farrell, and I'd like to introduce you to an innovative life enhancement system that induces optimal energy, health, body weight, and well-being. Implementation of just a few of the strategies within this program will make a dramatic difference in the quality of your life. Visit lifedynamix.com, and when you purchase over $30 worth of cutting-edge products, you'll receive this Life Transformational System on DVD absolutely free. Life Dynamix, the new science of energetic living.
Thank you for returning as we are interviewing mental health expert Dr. Mitchell Gibson. Dr. Gibson, is there any new interesting research related to mental health that you might like to share?
There has been some research that has come out that has made us somewhat cautious about what we do as far as treatment in mental health for depression, for instance. We recognize that children, when you're treating children for depression, we have to be careful giving them antidepressants, because some antidepressants can actually make a child more depressed and make them feel suicidal or aggressive toward others, and sometimes even toward their parents. So we have to be careful with that with the new research that just came out. Also, some of the new research on anxiety disorders says that when a person is anxious, and if they are actually able to follow a treatment modality with anxiety medication and rest, whereas they're taking meditation and rest in combination with their treatment, with their medication, they can get better faster. Taking medication and meditating works faster than just taking medication by itself. It really does seem to help.
Wonderful. Now, are there any important nutrients that the brain needs to thrive?
Two very important nutrients that the brain needs are serotonin, which we can get from green leafy vegetables and fruits like peaches, apples, oranges, that sort of thing. And vitamin C, as a matter of fact. Vitamin C helps not only fight off infections, but it helps decrease the tendency for a person to get depressed. Melatonin is another very important nutrient. Not only does it help with sleeping, it also helps regulate a person's mood. You can get that from some green leafy vegetables, some fruits and vegetables, but primarily you can get that as a supplement from health food stores.
Are there any natural alternatives to medication for depression?
There are a good number, actually, that have just come out that work just as well as antidepressants. One is called SAMe, which stands for S-adenosylmethionine. It is as expensive as the average antidepressant, however. It's an amino acid that is specially formulated to treat depression, and research shows that it works as well as Prozac in mild to moderate depression. Another remedy that is natural that works for depression is St. John's wort. We have to be careful with that in the Arizona environment, because exposure to sunlight when you're taking St. John's wort can make you have hives or break out and have itching problems. But those two remedies work just as well as antidepressants that you can take from a doctor.
Wonderful. Now, do you feel that some of the new biofeedback modalities are helpful for mental health?
Biofeedback is probably about 35 years old as a modality now, and doctors can actually become board certified in biofeedback and relaxation, and they work very well for not only depression, anxiety, seizure problems, difficulties with psychosomatic disorders are probably the most important reason we use biofeedback. People that have incontinence or problem with bowel and bladder control, those people can benefit a lot from biofeedback.
Wonderful. Thanks again, Dr. Gibson, and we are now headed to another break. Please join us.
I read in Men's Health, they say that kissing a woman is great exercise. And I agree. That's where I get the most resistance.
We are returning with Dr. Mitchell Gibson. Dr. Gibson, can you tell me 3 of the most important things that a person can do to help increase their mental wellness?
That is a very good question. I think people, in general, there are 3 very important things you can do to help yourself feel better, and they're easy, and if you just put a little bit of time and thought into them, they can help. I think number 1 is exercise. 20 to 30 minutes 3 times a week really does wonders toward helping a person feel better and look better and function better. Number 2, if you smoke or drink, don't smoke, and if you drink, cut it down to a very moderate amount. Those 2 things, smoking and drinking, cause a lot more mental problems than most people would care to even think. Also, decreasing your caloric intake. The average American takes in about 3,500 calories. Eating that much food takes a great deal of energy, and it is a lot of wear and tear on the physical body. Moderating how much you eat, decreasing carbohydrates, increasing the amount of protein you take in, helps a lot with mental health. And if I could add a 4th one, getting enough sleep at night. Insomnia is one of the leading causes of depression in the country, and also anxiety disorders. So just getting enough sleep at night, 7 to 8 hours for most people, is more than enough. The average American only sleeps about 5 to 6 hours a night. That's not enough for most people. Sleeping a little bit more helps with feeling better and functioning better.
Wonderful. Now, Dr. Gibson, do you have any products where someone might find your teachings?
Yes, I have a website. It's www.tybro.com, and I have a number of meditation and relaxation products that we sell on that site, and a lot of information about free mental health screenings, that sort of thing.
Dr. Mitchell Gibson, thank you so much for joining us today and sharing your mental health expertise with us.
Thank you for having me. I enjoyed coming. Thank you so much.
Absolutely.
How much sleep do you get at night?
Well, you know, I actually usually get 8 hours.
That's good.
Yeah,
most people don't get that much.
Go to bed early, wake up early.
I usually get about 7 to 8, something like that.
Wonderful.
Depending on if anybody tries to wake me up.
Okay.
Thanks for joining us. I'm Stephen Lawrence Farrell with Life Dynamix TV, the new science of energetic living.